Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology instructor, and today's conversation is on lymphedema and exercise. And following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Exercise can help lymphatic fluid move throughout your lymphatic system. You may ask, what is lymphatic fluid or what is the lymphatic system? And this is a one-way drainage system made up of organs, vessels, and tissues working together to move a clear, watery fluid called lymph back into the bloodstream. It is responsible for maintaining normal fluid levels, protecting against infection, and filtering out any waste and excess fluid. What is lymphedema? It is a chronic swelling caused by an abnormal buildup of lymph fluid between the skin and muscles. There are 4 stages of lymphedema. Stage 0, lymphatic system is impaired, however, there's no visible swelling. You may feel fatigue, heaviness, and tightness or tingling in the affected area. Stage 1 is when swelling occurs in the affected area, but does return to normal size with proper rest, care, and elevation and compression. You may see some pitting of the skin and indentation of the skin when applying pressure. Stage 2 is when you start to see significant changes to the skin. Your skin may feel spongy. Hardening of the tissue starts to develop. This is called fibrosis. And stage 3 is when the affected tissue has already hardened and is thickened, and the limb is large. An increase in swelling occurs, and that swelling is not reduced by elevating the limb or using compression. And also your risk of infection increases here. What can cause lymphedema? The tumor itself can damage lymph nodes and lymph vessels, disrupting the flow of lymph fluid. Lymph node removal, so any surgeries to treat your cancer, the greater number of lymph nodes removed can increase the risk of lymphedema. Injury or trauma to the lymphatic vessels, healing slowly after surgery, or being overweight can increase your risk of developing lymphedema. How to treat lymphedema. Always notify your doctor of any signs of infection, redness, pain, heat, or increased swelling or fever. Many patients go undiagnosed or misdiagnosed due to the lack of awareness on what lymphedema is or the signs of lymphedema. So request that referral to a certified lymphedema therapist for personalized care. Wear the compression garments to reduce swelling. Practice gentle exercises to promote lymphatic flow, and keep the affected area clean and moisturized to prevent any infections. How can exercise help with lymphedema? Muscle contractions can help pump fluid throughout the body. An increase in heart rate helps with circulation, and weight management helps keep pressure off of the lymphatic system. Exercise routines should include a combination of active, repetitive, non-resistant motion movements. And what exercises should you be doing with lymphedema? Strength training, aerobic exercise, and flexibility. Strength training should be done cautiously, starting with low weights, low repetitions, and with gradual progression. Aerobic exercise, start slow, do what you can, take breaks when needed, but this enhances cardiovascular fitness and improves circulation. Flexibility can minimize skin scarring and joint contractures that may lessen lymph flow. Always remember to listen to your body, and exercise is not one size fits all. Just start moving and it will promote an increase in mood and just overall feeling better about yourself. Thank you so much for being a part of our conversation on lymphedema and exercise. I hope some of the information we've covered today has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
I'm Morgan, your exercise oncology instructor for Maple Tree Cancer Alliance. Welcome to week 9 of our low intensity strength training program. This week, we will be focusing on hip and shoulder strength. Building strength in these areas is essential for maintaining proper posture, balance, and overall mobility. We will need a chair for the workout. As always, safety is our top priority, so remember to listen to your body and perform the exercises within your pain-free range of motion. All right, let's get started. All right, guys, we're going to start with our warm-up for week 9, and our first movement is going to be some front-facing leg swings. So if you have your chair ready, or if you have a wall nearby, I want you to hold on to that so that we have some nice stability. And we're going to put our hands on our hip, and we're just going to swing our leg forwards and backwards, keeping our knee facing the ceiling and leg nice and straight. And so we're going to do this 10 times on each leg. And swing 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then we're going to switch legs. So if you need to rotate to the other side, that's exactly what I want you to do. But for the sake of our video, I'm not going to switch sides. So we're going to do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And now we are going to go sideways. And so again, we're going to be holding on to that chair or the wall and keeping our knee facing forwards as we swing and cross in front of our body. And we're going to do a set of 10. And so I want you guys to try and stay as still as possible and have a nice tight core. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, and we're going to switch legs. So if you need to rotate sides, please do so. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, we're going to stay standing. And we are going to go ahead and move on to our arms for our warm-up. We're going to do a Cuban press. And so if you did our last video, we did a Cuban press in there. But what we're going to do is start with our arms at a horizontal with our hands facing in front of us at a 90 degree. And then we're going to rotate them to overhead and then press and bring our ears to our arms. And then back down and leaning those arms forwards. And so we're going to do a set of 10. All right, and up and press, back down, and bring those hands down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, we're going to stay with those arms. And so we're going to start with our hands and elbows in front of us with our palms facing our chest. And then we are going to press up to the ceiling. And as we do that, we're going to turn our palms to face out. And then we're going to bring those palms back in as we come back down. And so if you want to do this with some dumbbells, the same thing applies, that our palms facing us. And then as we push up, we're rotating to our hands facing out and then bringing this back down. This is called an Arnold's press. All right, we're going to do a set of 10. So palms facing us, elbows in front, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. And one last thing for our warm-up, we're going to do some Romanian deadlifts or RDL. And so what that's going to look like is we're going to have our feet underneath our hips. We're going to put our hands on our hips and just bend over at our hips with some soft knees until we feel that nice stretch in the back of our legs. And that's where we're going to stop, feeling that tension, and then using those muscles in our legs and our butt to pull us back up. And so we should have a nice straight spine and nice tight core. And we are going to do 10 of these. And so nice and slow, leaning forwards and back up. 1, 2, 3, 4, and it helps to think about screwing your feet into the floor and pushing your knees apart as we are bending. And 5, 6, 7, 8, 9, and 10. All right. We're going to move on to our workout. That was the end of our warm-up. So we're going to take our chair and we are going to position it so that we can do some toe taps to that chair. And so what that's going to look like is we're going to lift our foot up, tap the top of the chair, and then bring it back down. And then opposite leg. If you need something to hold on to, you can grab another chair or put it close to a wall so that you have something so that we don't lose our balance. And we are going to do 2 sets of 20. So chest upright, lifting that leg up and tap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. If you aren't able to lift your legs as high as a chair, I want you to pick something like a set of stairs or maybe even something that is a couple inches thick so that we can raise that leg up and still tap those toes. All right, we are going to do this one more time and another set of 20. So hands on our hips, squeezing those shoulders back, good posture, and tap in front. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. So now that our hips are nice and warm, we're going to do a couple wiggles, stretching out that IT band. So we're going to go side to side, pushing that hip out. And then we're going to move on to our shoulders. We're going to do a shoulder press. And so if you want some extra weight, you can grab some dumbbells or a water bottle or something that has a little bit of resistance to it. And we are going to put our hands in a ball or flat by our shoulders and elbows in front, keeping them there. So we don't want them out to the side, nice right in front. And we're extending up overhead and then back down. And so when we extend overhead, I want you to reach as far as you can without leaning backwards, that we are nice and engaged in our core and we aren't putting extra tension on our lower back. All right, so hands up at our shoulders, trying to get those elbows in front of us and kind of squeezing together. And we're going to do 2 sets of 20. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right, and we're going to do some shoulder rolls in between. Make sure you are squeezing those shoulder blades in the back when we're doing this, so that we're using those big lat muscles instead of those small little movers in our shoulders, because we want to use those big lats because they have more power and more effort, and they do a lot more for us. And one deep breath, and we're going to go back to that shoulder press. So we're going to have our hands at our shoulders, elbows in front, trying to squeeze them together just a little bit. Think about using those shoulder blades and pushing up to the ceiling. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 8 more, 13, 14, 15, 16, 17, 18, 19, and 20. All right, let's do a couple shoulder circles. Let those shoulders relax. Take 2 deep breaths. Nice and deep into that belly. All right. And then let's talk about our next movement. We're going to do some bicep curls. So now that we worked our upper shoulders, we're going to use those biceps and get them nice and strong. So if you want to use weight, just like I said before, you can have some light weights, a water bottle, something that has a little bit of resistance for us to make it a little bit more challenging. And we want to stand up nice and upright with a neutral spine and engaged core. We're going to tuck those elbows into our side, and you can even pretend like you're grabbing something. And we're going to go to full elbow extension and then bend that elbow up to our shoulders, and then nice and slow on the way down. All right, we got 2 sets of 20. And 1, 2. If you're not using weight, make sure you get a nice good squeeze in that bicep at the top. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. If we need to stretch out those biceps a little bit, you can grab both hands together and kind of press, extending to the front, focusing on getting those biceps extended and stretching. And do a couple shoulder rolls. All right, and one deep breath. And we're going to start our second set of 20. So if you want to add weights this time, I want to encourage you to do that. All right, so fists, elbows down at the side, nice engaged core, standing upright, and curling and squeezing those biceps at the top. 2, 3, 4, 5, 6, 7, getting to full extension, 8, 9, 10, 11, 12, 13, 14, 15, 16, 4 more, 17, 18, 19, and 20. All right, let's stretch those biceps out just one more time, resting in front, getting elbows to full extension, and squeezing, and then a couple shoulder rolls. All right, we are going to move on to our hip portion. And so having your chair available, we are going to do our sit to stand. And so if you don't have a chair or you feel comfortable squatting, that's what I want you to do. So when we do our sit to stand, we should be hinging at our hips, shooting our butt backwards, and then hitting that chair. And we shouldn't be resting and relaxing and then standing up. I want you engaged the whole time. So shooting those hips back first, then bending our knees, tapping, and standing up. And so we want to try and keep our back as straight as possible so that we get that good core and back activation. And we're going to do 2 sets of 20, just like with everything else. And if you need a lower target, I encourage you to do that. All right, hands on our hips. And we're going to hinge at our hips, bend our knees over our toes, touch that chair, and stand back up. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10 more, 11, 12, 13, 14, 15, 16, 17, only 3 left, 18, 19, and 20. All right. If you need to sit and rest your legs for a second, that's what I want you to do, but we're going to take a couple deep breaths. And our goal for our sit to stand is that we are doing it unassisted. If you need a little extra help, you can put your hands on your legs to help you stand up, but we want to try and avoid that so that we can stand up under our own power, but also keep that chest nice and upright so that we are not folding forwards and having to use our back to stand back up. All right, another set of 20, hands on our hips. And hinging at our hips and bending our knees over our toes. And 1, chest up, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 2 more, 19, and 20. All right. We are done with our chair for today, so I'm going to move my chair out of the way a little bit for our last movement, and we are going to do some sumo squats. And so kind of like our lateral lunges, we're going to have a nice wide stance. And so I want you to go and bend down as far as you can while having our knees track over our toes. So we want to avoid any caving in of our knees. We want our knees driving out over our toes and chest nice and upright. We can put our hands on our hips, or we can even have something to hold on to that's up against our chest, like a water bottle or a weight, to add some resistance. All right. And I want you to just bend down as far as you can. That's comfortable and in a pain-free range of motion. All right, we got 2 sets of 20. So we're going to turn those feet out just a little bit. Knees over toes, chest upright, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. We're going to shake it out. Take a deep breath. All right. And if you feel a burn in your glutes, that's exactly what we want to happen. And we shouldn't be hinging too much at our hips. And that is what the difference is between our sit to stand and our sumo squats. So sumo is a little bit more friendly with our hips, and it helps a lot with some glute activation and strength. All right, we're going to do our last set of 20, and then we're going to move on to our cool down. All right, knees over toes. 1, 2, 3. Squeeze those shoulders together. And 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 5 left, 16, 17, 18, 19, and 20. All right, let's take a couple deep breaths before we start our cool down. Nice into the belly. And one more. All right. So for our cool down, we are going to do some shoulder and hip cars. So since we're standing, this is a little bit easier since we don't have to worry about a chair in our way. But our arm is going to stay straight with our thumb up on top. You can have a fist, you can have your hand extended, but we're going to circle all the way up by our ear if possible, and then rotate, swinging that arm as far back as we can, and then through the bottom, keeping that thumb up on top. And so we're going to do a set of 5. All right, and this is 1, 2, really focus on using those shoulder blades and rotating that thumb up on top. 3, 4, and 5. All right, and then we're going to do the other side. Same thing, thumb up on top, reaching back as far as you can while rotating that thumb through. And 1, 2, 3, 4, and 5. All right, I'm going to grab my chair so that I have something to hold on to. For our hip cars, I would highly encourage you to hold on to something because doing this standing without anything is really challenging for our balance. And so with our hip cars, we are going to bring our hip up to the front. We're going to circle it out to the side and then rotate that knee down, turning that foot to the top, to the back, and then swinging our knee through to the front again. And so we're going to do a set of 5 on each leg. And I want you to just work through this movement in a pain-free range of motion as far as you can. So if we're not able to get our knees super high up or around to the back, I want you just to go as far as you can. So we're going to start with our knee up, out to the side, rotate that knee down, and then swing through. It's 1, and 2, 3, and 4, and 1 more, and 5. All right, we're going to switch legs. So opposite knee up, and we might have to switch sides. if you're holding on to something that's on one side. And so we're going to go up, out to the side, rotate that knee around, and swing through. It's 1 and 2, 3, 4, and 5. All right, we're going to go into a calf stretch. So if you have something to hold on to, I want you to hold on to it and lean into. So we're going to have that knee in front going over our toe, and we are going to be pushing that heel down to the floor with a straight leg in the back. And we're going to hold for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we're going to switch. So other foot in front, knee over toe with that bent leg, straight leg in the back, pushing that heel to the floor. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And then we have 2 movements left for our cool down. This next one is one of my favorites. It is called a hip opener. And so what we're going to do is we're going to step back like we're in a lunge. And then that front leg is going to go off to the side. And we're going to make it kind of wide. So it's a little bit of an awkward angle. But we're just going to push that knee over our toe and then back. And so this opens up our hip and those hip flexors. And we're going to do 5 on each side. So we have 1 foot facing forwards, 1 foot facing sideways. And we're going to press 1, 2, 3, 4, and 5. And we're going to switch. So again, we're going to go in that lunge position and then take that leg out to the side, turning it sideways. And then we're going to press into that side lunge. 1, with our knee over toe. 2, 3, 4, and 5. All right. And then to end week 9, we are going to do some simple yoga stretch. And so we're going to have wide feet and we're going to stretch up with both arms, swinging out to the side, looking up to the ceiling, bring them together. And then we're going to bring those arms down and bend at the hips, reaching towards the floor. Then we're going to do it one more time, arms out to the side, stretching up to the ceiling, and then swing those arms down and reach for the floor, and then come back to center. All right, that is the end of week 9. Thanks for joining me. See you in week 10.